Thank you so much for joining us for the 2020 Community Baby Shower for Macastan, Osceola County. The goal of the baby shower is to ensure that all families have what they need in order to thrive. This baby shower is for all parents, mamas included, that have babies prenatal to the age of 12 months. During the Let's Talk series, we are going to be talking about 3 different things: resources that you may need while you're raising your child. The second one is supports you might need, and we all need supports, and also the opportunity to network with other families just like you. I hope you will join us for the Let's Talk series. We hope that you feel special because you are. Let's talk.
Thank you so much for joining us for another session of Let's Talk. Today we have with us Rebecca, and she is with District Health Department number 10. Good morning, Rebecca.
Good morning.
So, could you introduce yourself and then share a little bit about what you do at the health department?
Yes, my name is Rebecca, as she said, and I am a nurse at the Mecosta County WIC office. And I've been here at District Health Department number 10 for just over 5 years.
Nice, right. Well, one of the things that we wanted to talk about, actually, there are two today. We went to talk about iron and lead testing and also fluoride treatment. So, quite a
Yeah.
little bit different. So, let's go ahead and start with iron and lead. What do our parents, what do our grandparents, what do we need to know about iron and lead testing in the community?
Definitely. So, iron is a mineral that helps your body carry oxygen, through the blood. And it's really important. We can know that if you don't get enough oxygen during pregnancy, if you're not getting enough oxygen, you're not going to feel great. You're going to feel sick, tired, look pale. There's not going to be able to focus on doing either learning, playing, or, working. And that's something that we are really focus on and trying to make sure. You can actually see behind me, I have a whole thing on
Yeah.
the importance of strong, healthy blood in iron. And so that's something that we test all, families as they come in for WIC. We test 1-year-olds and 18-month-olds to make sure that kind of that store of iron that they got from their mom, even as that's kind of gone out, that they are starting to get enough iron in their diet to kind of cover that. And then we also test pregnant moms and then postpartum moms. And it's just a tiny little finger poke. So it's
Mhm.
nothing too scary. And we're able to then just see where that's at. And then if it is low, we can try and talk through what are ways that you can increase that iron in your diet and hopefully get a little bit more energy. It helps actually with your immune system as well. And that's definitely important these days. Um,
Especially with the COVID, we know that
yeah.
autoimmune and immune, it's all so critical. And
Yeah.
so I am assuming that moms can really rely on the ability to get this test while they are actually at their WIC visit. Is that correct?
That's correct. So before COVID, when you would come in, if you were of like that right category, either age eligible to get an iron done, or in a category like pregnant or postpartum, we would do that right here in this appointment. Now,
Mhm.
right now, since we're doing some in-office appointments and some over the phone appointments, obviously, if it's over the phone, we're not going to be able to do that during that appointment. But then we're going to try and talk and say, okay, can you coordinate and get that done through either your OB or your pediatrician's office, or can we schedule it for when you come in the next time? So then we'll try and catch it, that next appointment time around.
Mhm. That's nice. And we could really rely on you guys to really keep an eye on what needs to be done and when.
Mhm.
So you talked about a poke, and I know another thing that you can test for in a poke with the kiddos is lead. Let's talk about lead a little bit.
Yeah, so lead is something that we don't require that families get done, but it's just a benefit because if we're already doing that finger poke, we can just in that same finger poke that we do the iron, we can also test for lead. And lead is something, it's a metal that our bodies don't need. And it's
Mhm.
unfortunately something that's in the environment. A lot of
Mhm.
people think about maybe the whole water crisis in their
Yeah.
water, but it can also be in paint in old houses. And we have a lot of old houses here in this
Yes.
county.
Yes, we do.
It also can be exposure if someone's doing a lot of automotive work and they've got maybe car batteries sitting in the yard that can kind of leach into the soil. And then if your kid's eating those mud pies and not washing their hands, that can maybe get some in. And so there's just some of those environmental factors that we worry about for lead. So again, if they come in and we try and just coordinate it so that you can get it that same time that you get that little tiny finger poke for the hemoglobin, we can also then do the lead and then talk through, okay, if it does come high, what does that mean? And there's
Mhm.
a range. Sometimes it might be a little bit elevated, and we say, okay, can we talk through your environment? Can we also talk through nutritionally? Because we know that if you've got good iron, if you've got good calcium, you've got these other things in your body, it's going to help protect your body against lead. So if it's, on that low side and we can't find anything that maybe is an exposure, we'll talk through how can you then protect. If it's higher, we're then going to get you hooked up with one of our public health nurses, and they're going to be able to then work with you and figure out where is this lead exposure coming from and what do we need to do.
Yes.
How do we can call the doctor and help coordinate then getting a second follow-up test just to make sure that there wasn't
Mhm.
anything that maybe is falsely high or anything like that, and then do what we need to do to then get that out of the environment, because kids love to touch things, they love to eat things, they love to do everything that they're sometimes not supposed to do. And so that's why we want to make sure that environment's safe for them.
Absolutely. And you talk about those 1 to 2 year old age groups to get tested. We know that that's also the age. I have a granddaughter right now that's the age where everything goes in the mouth, right? So that
Right.
exposure can be increased just by that lead. And we don't always know where we're getting our toys from. Like we know what store, but we don't know the product or the exposure that that lead might, that it might
Hmm.
have in there. I know that we have certain requirements in toys or that they don't have certain things. But a lot of times, we're even encouraging in early childhood that you give kids you introduce kids to um, things outside of toys. So like, spoons and pans and, things that you find within your home. And I'm just going to be honest, back years ago, obviously, I had, my dad was a hunter. And so we would have shell casings, they were empty shells from his hunting, but we know lead is very high in that because
Definitely.
that's lead in there. And so really that exposure, what are we exposing our kiddos to without even knowing what those situations might bring? And we know that high lead has um, really is connected to some developmental delays within kiddos.
Yeah,
So
and that's what's hard is because sometimes with lead, you're not going to see a kid be sick. You're not going to
no,
say, oh, like we were talking about with iron, you might see them be pale and not be able to focus and be grouchy. I mean, what 2-year-old isn't, but some
right,
is. But, you're not going to see that with lead, but you are going to start seeing maybe some learning delays or troubles, that you go, ooh, what's going on here,
yeah,
but we want to catch that before that, before it starts to affect their growth. And
right. And who would ever thought like lead? It might be in something that I, as a parent or a grandparent, I'm not even thinking about that it could be a lead exposure.
And I get it.
Um,
I mean, my
yeah,
2-year-old wants to play with everything but the toys that we bought him.
yeah,
I don't know
right.
why we buy toys because he just wants to go out and
There
play
you go.
all the things he
Yeah.
should. Yeah.
Definitely not intentional. Well, those are some really great things. We talked about iron and we talked about lead, but now let's kind of switch and let's talk about fluoride.
Yeah, so fluoride is something else that is an optional thing. We have a grant that we're able to provide a fluoride varnish, and it's going to be then applied by one of the nurses here in our office. And unfortunately, tooth decay is one of the most common, like
Yes.
chronic childhood diseases. And so that's something that as we look as a WIC program and say that, we're really focused on trying to make sure that families are as healthy as they can be, we can't ignore, the role that tooth decay plays in both a child's life and their development as they go to school and as they learn to speak and as they smile at their friends. We want to make sure, that they have the healthiest teeth that they can. So if
Absolutely.
you come into WIC and we're able to do fluoride varnishes on children ages 1 through 3. And
Nice.
again, right now with COVID, things are a little bit different. But again, talk to us and we'd figure out, are we able to still get that done? But then we would do a health and oral assessment and say, do you have good, healthy toothbrushing habits? Do you have good oral habits that are going to lead to either a healthy mouth or maybe some habits like drinking juice all day, all the time, or not
Hmm.
brushing that might put you at higher risk for that tooth decay. Then we're also
Mhm.
going to apply that varnish if you haven't had it already done, either through a doctor or dentist, and also get you referred to a dentist. I mean,
Mhm.
some dentists see kids all the way down to age of 6 months when those first teeth are erupting. Some
Yes.
dentists don't wait, don't want to see them until later. So we want to make sure that we get you hooked up with someone that can do that follow-up oral care.
Absolutely. And we know, even with some of those older kiddos, we know that if you were with that child and you reinforce what the parents had said for all these, for many years or many months, that's just reinforcing that it takes a village to raise a
Yes.
child. And so saying, oh, make sure you brush your teeth and things like that with those little ones, it really is critical to hear that from a few different
Mhm.
sources, so to say, to back up those that
Yes.
what the parents are saying. Um, Rebecca, I just want to give you the opportunity. Is there anything that you would like to say to the parents about whether it's iron checks, lead tests, and or fluoride treatments? Is there anything else you'd like to share?
I think mainly if you've got questions or concerns about, is my child low on iron or do I have exposure to lead? Or,
Mhm.
oh, I am starting to see something on their teeth, definitely follow up with your doctor, your dentist, but also, know that we are a resource here that we can at least do that initial assessment and say, you know what, I think there might be some concern. Let's make sure that you feel comfortable talking to that other provider about those concerns and make sure that we can then start getting that fixed.
Nice. Yes, absolutely. And Macassa, Osceola County is one of the greatest places I think that our families could live and raise their children. And this right here, you coming and sharing during our Let's Talk series really helps parents, helps to encourage parents to reach out and if they have questions, that there are so many just like you in agencies ready to help and answer those questions. So thank you so much.
You're welcome.